2nd of April. And you can see on top here, these are the dates for the past webinars, which were very focused on specific topics within vaccinology. Just to mention that those sessions have been very engaging and very insightful, even to me as a host. And just to remind you that this webinar series is hosted by Greg Hase, Rutani Mloyo, and myself. I'm Benjamin Kagina. I am co-director of Vaccines for Africa Initiative. And VACFA is based at UCT and specifically within the School of Public Health and Family Medicine. And moving on to the next slide. So the Vaccines for Africa annual vaccinology course has been running for the last 16 years. These are the aims of the course, and I'm not going to go into the details of these aims, but just to remind you, this has been a 5-day face-to-face residential course, mainly done here in Cape Town, South Africa. And you can see it designed for diverse and very broad audience, from immunization program managers and officers to researchers, as well as to postgraduate students. In the past, we've been able to cover different topics, programmatic challenges on immunization, basic epi and immunology surveillance, issues around underused and future vaccines, as well as media engagement on immunization. Recently, we've moved to web-based training in vaccinology. Keep an eye on our website, because we're building this component more and more as the need for online vaccinology training increase. Just a bit of a background as to why we've been doing this webinar series. We did a survey sometimes in January, February last year, and the purpose was of the survey was to look at the need for people to do refresher vaccinology training. And just to mention, the reason we did the survey, we noticed our vaccinology course is normally held in November, and the process involves advertising the course on within our networks and our website, and we see applications, people indicating that they've attended the course before and they want to come again. So we wanted to understand, why are we getting more and more people wanting to come back for the vaccinology training? And it was clear that people needed refresher vaccinology training. And these are some of the reasons given, and we're putting them verbatim from the survey. People want to stay up to date. And to qualify that reason, someone said vaccinology is a rapidly changing field, especially in the emergency of COVID-19. Then another key theme that came up from the questionnaire was the issue around to refresh and reinforce. People wanting to refresh on the knowledge that they gained, as well as the practicing of what they're doing after they trained. And obviously a big one is also networking, people wanting to stay connected with those that they met during the vaccinology course, and for those others that have done, for those who have done other years of vaccinology training. And it was clear that most people wanted to come for the face-to-face refresher training, but given the big number of people and also availability of technology, people think that also online training could be helpful. That's the reason we're doing refresher training, and we partnered with Pfizer, who gave us unconditional grant to do this. Okay, so these are the aims of this refresher vaccinology webinar series, is to provide an up-to-date information on the current and emerging trends in vaccinology, to refresh on some key vaccinology concepts, and to provide a forum for networking among the alumni. So you can see these aims are very much designed to meet the needs that were picked up during the survey. So for today's webinar, which is the last and the 5th of the series, we're going to have Dr. Kenelwe, who is going to speak to us about application of human-centered design principles in vaccinology. So it's very different to the format of other webinars where we've had 3 or 4 speakers talk on different topics. And then after Kenelwe speaks to you for between 1 hour, 1.5 hours to 2 hours, then we're going to just have a discussion, get some feedback for any session that you've attended. And for those who have managed to attend all the webinar series, give us feedback, and then we can look at the next step, including possibility of doing something similar in the future. So without any delay, I'm going to hand over to Kenelwe to take us through today's webinar training. But before Kenelwe starts, just to remind you that if you want to ask a question or make a comment, there is a Q&A chat box that you can type, and don't put it in the chat, just put it in the Q&A. If you put it in the chat, even if we want to transfer to Q&A, we can't, because we don't have those rights as hosts. And also at the end, you'll be able to have an opportunity to make comment. You'll have the right to activate your mic and speak to us. All right, with that, I hand over to Kenelwe. And Kenelwe, thank you so much for your time, and over to you.
Thank you, Ben. Good afternoon, everyone. Let me quickly share my screen. Right. So as Ben has, can everybody hear me? Just give me an indication if you can hear me.
Yeah, we can hear you.
Perfect. All right. As Ben has already mentioned, my name is Kenelwe Munyai, and I am not in the medical space. I have a background in design, and so I'm trained as a designer, and hence me talking about human-centered design. And the goal of today's session is for me to share the principles of human-centered design and how it fits into the immunization space, and as well as share some examples of the work that I've done with the VACFA team, but also in other projects outside of VACFA as well. All right. So about me, as I've already mentioned, I am a designer, and I'm trained as a designer in the traditional sense, which is to design products. But I've sort of moved on from that to now designing meaningful learning experiences and processes and ways of working. And I am an optimist, and I believe that something better should and could exist. And hence the always trying to find different ways of doing things and different ways of working. And those who know me already know that I love asking questions. I ask a lot of questions because I think by remaining curious, we are able to continuously learn. And obviously things are constantly changing in the world around us, and asking questions help us learn. So in terms of our agenda, I am going to introduce you to HCD and the principles of HCD, and then share some examples. So obviously, some of you are probably wondering, design, human-centered design. I'm not a designer. What is design even? Or the understanding of design is related to aesthetics, or the chair that I'm sitting in, or the clothes that I'm wearing, the roof that I'm sitting under. But design is actually more than that. At a philosophical level, it's about the way we deal with the world around us, how we are and how we shape the world that we've been placed into. But of course, if you talk to people out there, a lot of the times you're going to hear about the things that are related to aesthetics, which is what design is mainly known for. But design is actually an action of bringing something new into existence. But it's also a process that can be used to solve problems. It's also a process that can be used to help us gain empathy, to understand the problem and the people that are impacted by the problem that we are trying to solve. It's also about creativity, so finding new ways of doing things, and collaboration as well. So finding ways of working with people that are different from us or who are trained differently from us. And it's also about agency, okay? So the feeling of control when we are trying to design or develop new solutions, but also understanding the consequences of those solutions that we are developing. So design is actually something that we do, all of us, on a daily basis. And I love this definition that says every one of devices a cause of action that aims to change the current situation into a preferred one is actually designing. So you could be, doing a simple thing of, coming up with a spreadsheet to present information in a certain way. That is designing. But ultimately, the purpose of design is to improve the quality of life for people and the planet. So what is human-centered design? It is basically a mindset and an approach to problem solving that focuses on human values when designing, whether it's systems, services, or products. And it begins with understanding who are the people that are impacted by the problem that we're trying to solve. And it does integrate a broad set of practices. And I am going to talk more about those practices at a later stage. And of course, human-centered design is applied from developing a strategy within the organization or developing programs or even projects, or simple designing ways of working within an organization. So at the core of human-centered design, we place a lot of emphasis on these three key elements. So we're always trying to find a balance between these three key elements. The people, so the desirability of whatever it is that we are trying to develop. So from a human perspective, does it make sense? Is it something that they need? Does it solve a problem for the people? And then the feasibility, do we have the capabilities? Do we have the technologies required to implement whatever solution that we are trying to develop? And then does it make business sense from a viability perspective? And then, so it's about finding the balance. Innovation is about finding the balance between these three elements. So we're always trying to find the sweet spot of these three elements. And of course, human-centered design owes its methodology, or some of the methodologies that we use come from the behavioral sciences. And we put a lot of emphasis on human values and experiences over efficiency. And it doesn't mean that we forget about those, but we do try and understand the people, because it doesn't matter whether you're trying to solve an environmental challenge or a technical challenge from a technology perspective. Ultimately, they are human beings that are using that technology, and understanding the people's experiences and behaviors is quite important. So design involves exercising your head, heart, and hand. So when we're talking about the head, we're talking about the problem-solving aspect. So applying certain practices in order to conceptualize and visualize the problem that we're trying to address. And then the heart, so putting people at the center, understanding the people that are involved in the problem. And then, of course, the practical skills. Designers are trained to do things, to make things. And so making ideas tangible is quite important, especially when you're working in a diverse, collaborative environment. It becomes a way to communicate ideas, and it becomes a way to come to a shared understanding within the team first, before you can bring in other stakeholders or even help other people understand. And by making ideas tangible as well, will help other people understand what we are trying to do faster. Our brains are able to make connections faster when we can see something than having to listen to words. Because obviously, if you are working in a diverse team, we're all trained in our disciplines, we use language in different ways. And so sometimes we might spend a lot of time trying to clarify things or trying to help our team members understand what it is that we're trying to say. Whereas if we make ideas tangible and we can visualize and show what it is that we're talking about, we are able to make connections quicker and move faster. So there are some key principles to human-centered design that are applicable and that sort of drive the way we do things. And those principles are, the first one, as you can imagine, is about being people-centered. So this means considering the people who are involved in the problem that you seek to address, and not just understanding the person, but also understanding the context of those people. So understanding their experiences, their behaviors, their needs and motivations. Because if you're only going to focus on the problem that you are seeking to address without necessarily understanding the context, that's why at times we end up with solutions that don't necessarily create the change we want them to create, because the focus was so much on the issue itself, not the context of the issue as well. So we use a lot of systems thinking tools to help us understand how the problem is connected to other issues as well, and the context that the person exists in, all right? And then, of course, another key principle is the notion of embracing time as a positive constraint. And this basically speaks to the notion of time pressure, which can actually help us and spur us into action. Because in other fields and other disciplines, the ways of working are to sit and discuss things. Whereas in the innovation space, we use time as a positive constraint to say, instead of over discussing, why don't we try something out and see what comes out and quickly test whatever it is that we are thinking so that we can learn fast and move forward. And that learning fast means involving people. So not developing solutions in isolation, but continuously engaging with the people that are impacted by the problem. And there are two ways of doing this. You can either design with the people that are impacted by the problem, or you can design for the people that are impacted by the problem. Though these two different approaches, one simply means if you're designing with, it means that you are involving the people from the beginning. They are part of the journey. So as you create, as you develop the understanding of the problem, you're doing it with them. And what that does is it helps in terms of creating a sense of ownership of the outcomes of whatever it is that you're developing, whether it's a product, service, or a system. And if you're designing for, again, it's important that you deliberately make sure that you build in time for you to go and engage with the people so that whatever it is that they're developing is informed by the people, and that at least they get to say and give you information and give you feedback on whatever it is that you are trying to do. And of course, there is never enough time. And what human-centered design does is it helps us realize that we will never have enough time to fully understand the problem. But if we use time as a positive constraint and quickly try things out, we are able to move forward and learn. And of course, the other key principle to this approach is the concept of empathy. And when we're talking about empathy, we're not just talking about, often people talk about putting yourself in someone else's shoes. But at times, it's not really possible for you to walk in somebody else's shoes, because as an example, I live in in an area where I can't possibly understand what it's like for somebody who's living in another context or in another part of the city. Instead of trying to walk in their shoes, which is unrealistic, I can take the time to understand. So hear people out asking questions in order for me to learn and gain some perspective on what it is that they're experiencing. So this is what we refer to as cognitive empathy. But of course, there's also emotional empathy, which is the first experience of empathy that we all have as human beings. As an example, as a child, your mother smiles at you, you smile back. And so understanding somebody else's feelings or catching somebody else's feelings is another element. So, and then there's also compassionate empathy. And this is understanding someone's feelings and experiences and taking an appropriate action. And all these different elements of empathy, they play a role throughout a project or a collaboration. And they come in at different levels, and all of them are valuable. And they play a role in ensuring that we gain a better understanding of the people that we are dealing with or we are working with. And then, of course, in order for collaboration to really work, one has to create what we call psychological safety. And we're talking about creating an environment where people feel safe to participate and feel secured to speak up when they need to. And this requires things like, being aware that we should be giving each other turns in terms of talking. So not taking over the space and be the loudest voice in the room, which is currently what I'm doing. But giving other people airtime when you are in a collaborative environment. And this approach of pass it on, so giving other people an opportunity to speak. So once you've shared your thoughts, give somebody else an opportunity to do the same. And then, of course, asking questions is quite important as well, encouraging people to ask questions. And remember that no question is silly. That's what helps create a safer environment for people to be themselves and be able to collaborate meaningfully. And then another key principle is the principle of one conversation at a time. Obviously, we live in a world where everything is dynamic. Things are moving at a very high speed. A lot is happening around us. And sometimes we can get distracted. And so we do need to create this or practice this skill of having one conversation at a time. If we are having a discussion about a certain topic, just keep the conversation on target. And this requires developing listening skills. And it may feel uncomfortable to do that because we often listen to respond as opposed to listening to hear what the other person is saying. And you'll notice, for those of you who have participated in human-centered design sessions, we often deliberately create a working environment that is different from a traditional meeting environment, so that people can, people can sort of practice the listening, but also facilitating the conversation in such a way that everybody feels included. Because if you are sitting in a big space and everybody is just jumping in when they feel the need to speak, that doesn't necessarily help, especially for people who are more quiet. Whereas if you break people up into smaller groups where everybody can't hide, every person cannot hide behind other people, but they're part of a team, so they can have a conversation within the team and then share with a bigger group. So it's about practicing different ways of working as well to ensure that these things that we're talking about, like creating psychological safety, it's not just saying, but it's actually practiced. And then, of course, staying focused on the topic is also quite important. And what we mean by this, we mean persisting with the task at hand and concentrating on the activity that needs to be done. And of course, it can be difficult when you have multiple things that you need to be working on at the same time, but it's a skill that you need to practice over time. And I love this proverb that says, if you run after two hares, you'll catch neither. So try to focus and keep your mind focused on the task at hand, and you'll realize that by doing this, you actually tend to be more productive. And of course, by also staying focused on the topic, focusing can also help you see things differently. And I'm sure some of you are looking at this picture. If you focus a little bit more, or you know, keep looking at the picture slightly longer, you can start seeing other things. When you look at it for the first time, it shows something else. But then once you spend more time looking at it, you start realizing actually there's more to the picture than what you saw at the first glance. So that's what staying focused on the topic is all about as well. Because if you do allow yourself the time to just concentrate, you're able to start seeing things differently. And then, of course, building on the ideas of others is quite important, especially in a collaborative environment. Obviously, in our education system, we are trained to think of ourselves as the lone geniuses that are able to come with ideas on our own. But in reality, ideas become even better when we share them with other people. And other people can help shape them and make them even stronger. And I love this proverb from Nigeria that says, other people's wisdom prevents the king from being called a fool. So by putting ideas out there and collaborating with other people, you get to come up with even better solutions to complex problems. And also the world that we live in today is so dynamic and complex. There's just no way that one person can be able to solve them. And so this culture of collaboration and embracing the fact that other people can help us see things from a different perspective is quite helpful. And of course, embracing diversity is critical as well. And when we're talking about embracing diversity, we're talking about all the dimensions of diversity, including different working styles. So you might find that in your team, there are people who are very good at different things like coordinating or shaping ideas or completing tasks or even implementing. And of course, there are some people who are very good at generating ideas, whereas some people are specialists at certain things. And so always ensuring that within your team, you have as much diversity as possible. And research shows that teams with a variety of cognitive types produce higher levels of innovation. And so we try and make sure that when we are working on projects, we deliberately ensure that we find, different people with different working styles or even disciplines and so forth. And of course, collaboration is key, and especially the notion of radical collaboration. And you will see in the examples that I'm going to be showing later on how radical collaboration applies. And I'm sure that for some of you, you're thinking, okay, what does it even mean? So when we're talking about radical collaboration, we're talking about moving away from the siloed approach of working where you have people who think the same because they've been trained the same or they're trained in the same discipline, but bringing together different disciplines that would otherwise not be considered to be able to work together. And of course, we have to acknowledge that this is not an easy thing to do, but it has to be driven by openness and perseverance as well, because obviously it's going to be difficult when you are bringing together disciplines that are not used to working with each other because they see things differently. But by persevering, you are able to capitalize on the diversity that you have, and you are able to come up with better outcomes. And the reason for that is, and I've already mentioned this earlier on, that we can no longer focus on the single discipline thinking, because the world that we live in is so complex and dynamic. And just as an example, and I love sharing this example in my sessions. If you present a healthcare issue to a lawyer, he or she will propose a new law because that's what they know, right? And if you ask architects, they'll suggest designing new hospitals. Engineers will propose building those hospitals. But actually when you bring together these disciplines and other disciplines as well, you might realize that maybe the solution is not even any of the things that I mentioned here. Maybe a solution is something completely different. And maybe it's even because innovation is also not always about something new. Sometimes it's about thinking differently about the problem and taking a solution that exists in another context and trying it out in a different context. And that's how so it's about really being open and bringing together all these views and all these skill sets and disciplines to help look at a wicked problem from a different perspective. Okay. And of course, along with all these other principles that I've mentioned earlier on, we emphasize this culture of experimentation. And by experimentation, it's basically an approach to failing safe. Because if you try things out on a small scale before you invest a lot of time and money, you're able to quickly learn whether something is going to work or not. And I love the proverb that says, smooth seas do not make skillful sailors. And that's exactly it in innovation. Innovation is not a linear process. It's an iterative process where you continuously need to try stuff out. And if you experiment and test things and learn, you are able to improve and progress and fail forward. And of course, another, and this is the last principle, is the notion of being visual. And when you're talking about being visual, I know that to a lot of people, they hear the term, they think, okay, I need to draw pretty pictures, and that's not something that I'm comfortable doing. But actually, being visual is not necessarily about drawing pretty pictures. It's about making information visible. It's about helping the brain understand things faster, because if I can see what we are talking about, even though you could be presenting it from a health perspective, if I can see it, I can quickly make the connections as well. So yes, images work as well, but also just being open and making information visible. Often when we are working on projects, and you're going to see in some of the pictures that I'm going to share later on, how every time we work on a project, we make the project visible. So anyone can walk in and see where we are and the kind of information that we've collected up to a certain point. So creating these spaces where everybody can see what we are talking about. And of course, visualizing as well helps clarify thoughts. So human-centered design is basically a mindset that offers systems thinking tools that are useful for dealing with uncertainty, ambiguity, and complexity. And of course, it does require innovative strategies to navigate not only our own lives, but also to make sure that we are trying to meet human needs. The human-centered design approach in itself is not an outcome, it's a mindset. In order to get to the outcome, we use what is known as the design thinking process, okay? So with the principles that I've mentioned earlier on, and just to mention that if you guys have any questions regarding any of the concepts that I'm mentioning here or the things that I'm saying, feel free to drop them in the Q&A, and later on I'm gonna spend time answering your questions. So the design thinking, the human-centered design approach can be used with different processes like the design thinking process or the sprint or the agile methodology. There's a lot of other innovation approaches that are used in combination with human-centered design. And all of them, ultimately, the end goal is to solve problems from a human-centered perspective, but using different ways of working. So design thinking refers to the cognitive activities that designers apply during a process of designing new products, services, or systems. It is a formal method for practical, creative solution of problems and creation of solutions. And basically, it's a structured approach, but it can be very chaotic as you do it, because it's all about making the information visible, and it's highly collaborative, and it's very fast paced as well. So the principle of embracing time as a constraint. So every task is very timed, and it's an iterative process as well. So it's not linear, even though when you look at it, when you look at visual representation of it, might look linear, it's actually not, because it requires a lot of back and forth in order for you to get to the outcome. So ultimately, what the design thinking process helps us do is, as you embark on it, you go through you diverge and converge continuously. When you're diverging, you're putting a lot of information out, you're sharing your thoughts, and you are collecting information from various sources, using either interviews or immersing yourself in the context, and even observing the people that are impacted by the problem. And then when you are converging, you are analyzing and making choices. So taking the lots of information that you have gathered and synthesizing that information and choosing what information would be relevant in terms of helping us move forward and you're not doing that in isolation. Of course, you're doing it in collaboration with your team. So often we start with what we call a trigger, and a trigger can be a problem statement that we think the problem is at that point in time, trusting that we're going to go through a process that is going to help us come to the right problem in order for us to develop the right solution to that problem. So there's a lot of reframing that happens in the design thinking process as well. So you diverge and converge continuously, and there's a lot of it's a lot of iterative phases. So you are continuously going back and forth. So you can start off by sharing your own assumptions or understanding of what the problem is. And once you've gone and interviewed people, you realize that actually maybe the people that have decided to interview were not the people that you should have spoken to. And then you go back again to the stakeholder analysis part of the process in order for you to see, are there any stakeholders that are missing, or can we change anything? Can we add other stakeholders? And again, once you've developed a solution as well, you go through the same iterative process, even during the implementation of the solution itself, because innovation is not static, it's continuously evolving, and the world is quite dynamic, and the people are changing as well. So as you implement your solution as well, you're continuously learning, you're developing a better understanding of how people are experiencing whatever it is that you're trying to implement. And that helps you continuously improve. So it's a journey, basically. So understanding and addressing core problems is about first spending the time to understand what are the root causes. So this is where systems thinking comes to play as well, because it helps us understand what is the problem that we are trying to solve linked to, because often complex problems are linked to other issues. A health issue is not only a health issue, it could be linked to other, economic factors and other social issues as well. And of course, design has always played a part in the health space, in helping us understand the human being. And Leonardo da Vinci was the first one to help with his drawings of the anatomical investigation, which help the medical field understand the human body. And understanding that solving problems is a journey. It's, like I said, it's an iterative process. It starts with spending a lot of time understanding the problem from our perspective as an innovation team, and then going out to actually speaking to the people that are going to help us, that are experiencing the problem themselves. And it can take months, it can take weeks as well. So you can design the project depending on your on the context and depending on the problem that you seek to address as well. And so now I am going to move on to talking about design in public health. And of course, I don't need to tell you this. You guys are working in this space and you know how complex the area of public health is. And it does require systematic solutions that drive change at an individual, community, and societal levels as well. And in order to achieve this, in various parts of the world, people have embraced the human-centered design approach in order to solve problems within the health space. And the reason for that is the realization that human-centered design uses more participatory methods that acknowledge that, yes, as a health professional, as a public health professional, you can be an expert in vaccines, because obviously that's your training and that's what you do, but also acknowledging the fact and understanding that even the patient themselves or a community member, they are also an expert in their own lives. And so collaboration then becomes key, because if you bring together all these different perspectives, then you are able to have a richer understanding and a better understanding of the problem that you seek to address, and also appreciate the complexity of the context in which the problem exists in as well. So we believe in human-centered design that context is key. So understanding the context, and hence the emphasis on, using systems thinking tools to help us understand how is the problem that we seek to address, what is it linked to, what is the context, what are the challenges within that context, and also looking at a person alone. When you are trying to solve a problem, that person is a member of a family, a community, a society, and those also influence the decisions and the behaviors that a person makes. And therefore, understanding all these different elements can help in terms of developing better solutions. So healthcare is filled with complicated challenges, and now there has been a realization that human-centered design can play a role, whether it's improving the patient-doctor relationship, or improving the efficiencies within the healthcare system, or even introducing technologies that can help improve certain aspects of health. There is a growing realization of that. And design can help craft standout user experiences, because human-centered design is all about the human experience, understanding the human experience. Now, even the big corporates, the big consultancy firms, they are also talking about the application of design in health. But of course, from a consultancy perspective, they still drive the design for approach, where they go in with the solutions that they think will help address the problem. But there's also, like I mentioned earlier on, there's the other approach, which is designing with, so involving the communities in the solutions that they are trying to develop. So human-centered design plays at different levels. It can be applied in different levels. So at an organizational level, It's about helping, develop strategies, develop a culture and processes to improve the way things are done. And then at a program level, it's used to improve the effectiveness of the programs. And then at a project level, and this is usually the most straightforward approach that some organizations that are not used to bringing design or engaging with design would start with. So start by bringing human-centered design at a project level, use it to develop a project and come up with solutions or concepts. So I've spoken about I've introduced you to human-centered design and the design thinking process. And I have also spoken about the human-centered design principles. And now I am going to take you through some examples of projects that I've been involved in. Some I've been involved in myself, but some are projects that have been done by other organizations on the continent along the lines of immunization specifically. So the first one is a project that we did with the VACFA team, which was the challenge. Remember, I spoke about the trigger that we use as an entry point to any project, to any human-centered design activity that we do. So the trigger in this project was to redesign the expanded program on immunization in a world where coverage is low in South Africa and systems have not changed in 40 years, and there's a lot happening. So this was informed by the fact that research was done to look at what has happened over the period of 40 years. And one of the things that we picked up was the fact that from a systems perspective, things have not changed, but there's a lot of activities, initiatives that are taking place. And of course, here, again, we embraced diversity. So I've listed here the representatives from the different sectors that came together to work on this project. So from the Department of Health to advisory group, national advisory groups, pharmaceuticals, NGOs, academics, private corporate representatives as well. Because like I said, in human-centered design, if you are dealing with complex problems, it's helpful to have as much diversity as possible, because then you are able to look at the problem from different perspectives. And what we did here is during the workshop, the research, so the outcome of the analysis of all the existing things that are happening in the research and the systems related activities or initiatives that have been taking place were shared. And based on that, looking at also the experiences of the people themselves that are involved within these activities. And then once all the various stakeholders have a shared understanding of what the outcomes were, then they were able to transition to think more about, okay, what are the next steps? What are the solutions that we can think of to address some of the challenges that we see, that we all agree are taking place, or that we all are experiencing as we work within this space. So some of the things that, or the focus of this session was to report on review of innovations in the vaccine space, to define the key challenges in the South African vaccine space, and to identify areas for development of key innovations to challenges in South Africa. And of course, to identify potential public-private partnership, and to design implementation and implement pilots, and establish working groups to take the process forward. So I've already mentioned the ways of working. part of it is making the information visible, so that as the diverse perspectives are working together, are all looking at the information and seeing the same information, and also realizing that I, as an individual, can be looking at, or I can have an understanding of what the issues are, because I'm limited by my own biases and experiences. But by working with other people, you are able to see that, okay, whatever it is that I'm working on is actually linked to other things, and there are other people involved as well. So you get to hear their own understanding. So it was a lot of meaningful engagement, but in a facilitated way where everybody, felt free to share what they thought. And that was helpful. And ultimately, the teams also developed low fidelity prototypes that helped them communicate the ideas in terms of, the next steps and moving forward. So this is just an example of what a typical session would look like. And as you can imagine, it's loud, it's very energetic. There's a lot of activities going on, and of course, time as a constraint as well. So moving from understanding what the problems are to thinking, because it's not enough. The whole point about innovation is not to dwell on the problem itself. It's important to understand the problem, but equally, it's important to also try and come up with potential solutions to the problem. And of course, when we are talking about solutions, we're not talking, it's not going to be a final solution. Like I said, it's an iterative process, but at least you have a starting point on which to build on going forward beyond the workshop itself. So the outcomes of the whole process was a common understanding of the priority challenges within the South African vaccine space, and then consensus on ideas for design proposals to enhance and identify vaccine program components. And then, of course, the prioritized pilot project list. So here, again, you're getting buy-in from a larger group that is very diverse in terms of things that needs to happen. And of course, establishing of the interdisciplinary design working groups as well was part of that process as well. The other project that we did back in 2017 with the VACFA team was the integrated immunization data solution project. So here, it was not necessarily the VACFA team that worked on the project, but it was a group of postgraduate students applying the design thinking process to understand what the issues are. And that's the thing about human-centered design as well, is that you don't necessarily have to be an expert in the area of the problem, but you need to engage with people that are experts within that area, so that you can gain empathy and understanding of what the real issues are. And also what this does is it sort of helps bring a different perspective, because you have an outsider's view of how they understand the problem, and therefore proposing a different solution. So this was a challenge that was given by the VACFA team to the team of postgraduate students. Their challenge was to redesign the immunization data capturing process for data managers and data capture clerks in a world where data quality varies, and there is no, sorry, I can't see some of the text because of the, there is no post-immunization event monitoring. And so the project team that worked on this project, there was an MBA student who also happened to be a medical doctor. And there was an international relations student, a geographic and environmental science student, and a chemical engineer. And basically they went through the same process that I've mentioned earlier on, which is to first start and try and understand the problem, just doing basic research, looking at what is out there, and also, of course, engaging with different stakeholders in order to gain insights. So this is about interviewing people, immersing yourself in the context, observing how people are, experiencing on a daily basis. How are people within the context of the problem operating? And some of the insights that they found from engaging with all the different stakeholders is the fact that patient health records sometimes go missing or are incomplete or poorly recorded. So you can imagine in a case where it's a very busy environment or it's a very busy clinic, things like that would happen because you're dealing with human beings, right? And then nurses sometimes use vaccines which have been compromised through temperature fluctuations or expiration. And then the other thing was the single immunization nurse per clinic often has to see a high number of patients. So these were all things that emerged from this group of students that some of them have no knowledge of the health space, but through them engaging with the health professionals, they were able to learn and come up with these insights. And what they proposed as a solution is basically an app. And these are some of the benefits of the app that they thought the app would have. And this is the final solution that they proposed. So a fingerprint access nurse and child platform, or what they call integrated immunization data solution. And basically it can be accessed universally, and it has a large mobile nurse interface, and it's also linked to other components. So once again, it's basically coming up with ideas that obviously, yes, this is what they're proposing. Whoever is implementing the solution have to go back and continue testing to see whether this is something that is really gonna, even though the students themselves have tested with the users, the testing doesn't end with the testing that they've done. The testing has to continue even during the implementation to see, does it actually, because it's different when you're testing something that you're still developing to actually getting it, to actually the final product that is on the ground, that is being used on a daily basis. And the other example that I want to share is a project that we did in 2019, again with the VACFA team. This was a project to redesign the immunization experience, or the maternal immunization experience. And the people that were involved they varied from big funders, WHO and government. And then of course, it also included people who work within the EPI space. And also this team, or this group of participants, was quite diverse in terms of the countries that they represented. And so I'm hoping that by now you're realizing that within this approach, we try and maximize diversity, because we see it as an opportunity to not only learn, but also to help in terms of sharing experiences as well. Because by having different countries engaging, it also helps not only the funders realize, because there's always this perception that, we can implement a project in Africa. We can design one project and we can implement it in Africa, but Africa is quite diverse. And so even though, yes, it's, one big African continent, but there are certain unique elements within each country. And what was interesting here was just to learn how different each country is, and how, in some cases, how culture influences how people access health services as well, which was something that I never even thought about. And I think the opportunities to collaborate with other people and being open to learning actually helps as well, because it opens your mind and helps you realize that we cannot continue with this, trajectory of always thinking that we can design one solution and it's going to be applicable in every part of the continent. Sometimes it's not even applicable in every part of the country. And that's something that we need to embrace and appreciate. And the other example that I want to share is a project that I did with a team in Malawi.
She says she's ringing the bell and there's no one answering.
I don't know if the bell is, maybe it's not ringing. I don't know.
Hi.
Okay, bye.
So sorry, I was interrupted by the people talking. So this is a project. This is a project that I worked on with the team in Malawi. It was a project that was done in collaboration. It was a collaboration between UNICEF and the School of Medicine in Malawi. And the team set out to redesign the experience of caregivers of children between a certain age group when accessing routine immunization services in the outreach clinics within Malawi. And here, what we ended up doing is, instead of just focusing on the UNICEF team and the university team, we realized as we were unpacking the context of the problem, we realized that actually there are other stakeholders that are involved in the project. For example, there are some NGOs that are implementing partners for UNICEF. And so bringing them on board as well, so that they can help in terms of creating an understanding of the context. And so we worked on this project for a period of, I think it was 3 months. And some of the insights that we got from engaging with various stakeholders, so from mothers, caregivers, schools, even chiefs in the rural areas, some of the issues were, the biggest issues were the waiting time that a lot of mothers have to spend at the clinic and paying for services. And then the cancellation of sessions because either the healthcare worker doesn't have transport to get them to the community that they need to serve. And then the other key issue that they picked up through the interviews was what they call poor hospitality. So a lot of the parents would give, explanation as to why they won't go to sometimes they end up not going to the clinic to get the services, because either they are taking care of their, entire family. And so having to walk long distances an entire day would mean that that day, there is no one to take care of the rest of the family. And also when the kids are younger, mothers are able to carry them on their backs over the long distances. But once the child gets older, that's a completely different story. And we are talking about places where there are no roads or public transport to connect between. So that's why the understanding of the context becomes so important. Because if that is the reality of these people, how do you then design services that respond to the context, that makes it easier, that meets the needs of these mothers, so that they are able, because it's not that they don't care about the well-being of their kids, but the reality of their lives is that there's all these other priorities as well, that competing priorities that they need to consider. And so one of the similar to what I've mentioned earlier on, going through the process is developing, low fidelity prototypes and testing those prototypes with the community members and even healthcare workers in order to learn whether the ideas that the teams think might help in addressing the problem will actually help. And in some cases, we found ourselves that having to even change the approach. So instead of, creating a prototype using things like Legos, we realized that actually you can develop prototypes using found objects within the community themselves to help the community members communicate from their perspective, their understanding of what the issues are. So basically, this is just the testing of the prototypes with the health professionals. So the solution that the team ended up proposing was what they call a magnetic clinic, which is an integration of immunization and early childhood development services. And so these were all the features that they thought that the solution should have in order for it to meet the needs of the mothers. And of course, testing of this solution was with a diverse group of stakeholders in order to get their perspective. So the things that they've incorporated here are based on the conversations that they had with the various stakeholders. And the last one that I'm going to share is an example of a project that was done by Path, again, around the data management or the data innovation, because that seems to be an issue in most cases. So Path worked in Tanzania as well to develop a solution. So the example that I shared from the students, from postgrad students from UCT, this is a similar project from Tanzania, where they also applied human-centered design, worked with healthcare workers, got feedback, and from that feedback, developed a solution. And now they were testing the actual high fidelity prototype. So this was just a low-fi prototype. Even the one from the UCT students was a low fidelity prototype. Now Path had developed a high fidelity prototype, which is close to the finished product. So an opportunity for the participants, for the healthcare workers to actually test and see how the platform actually works for them. So in wrapping up all the stuff that I've shared with you, I just want to say that human-centered design is a systematic approach that uses diverse skills to analyze problems and their context and to pursue innovation while placing real experiences of people at the forefront. So it's about, before we think about whether it's going to be feasible or even viable from a business perspective, let's first spend time understanding the people. Let's analyze who is the person, what is their context, and also if we are saying the problem is data being incomplete or going missing, let's understand the context. What is that context of that person? And who is the person at the center of this? Who is the person handling all this information? What is their reality? And then we can start thinking about ways to develop a solution that meets the needs of the person that we're designing for. Thank you. That was a lot of talking. And now I guess I can take your questions. Any questions? All right, so now I'm just gonna wait for you to increase the screen. Okay. So the first question is, so how to foster collaboration amongst groups who need to be involved for sustainability, but may not traditionally have engaged well? I'm thinking of local government and community networks, for example, where cohesion at community level can sometimes be seen as a threat, even though it shouldn't be. I'm thinking so specifically about addressing issues of vaccine hesitancy in communities. That's a very good question. So in terms of fostering collaboration, as I've already mentioned before, one of the key elements of human-centered design is this notion of creating not only collaboration, but also creating ways of working. So co-creating ways of working. So moving away from this notion of we are the experts and we are coming in to, we're gonna tell you what should be done and how you should do it, but also acknowledging the fact that these people understand their own context, and people are likely to be more embracing if they see themselves as equals as opposed to being talked at. So making them part of the process, co-creating the process of engagement with them from the beginning. So involving them from the beginning, saying, look, we realized, we've noticed that, in this community, the, vaccine levels are a little bit low and we want to understand. So spending time understanding first, what is the reality within that context? What are the issues? Because without the understanding, without the asking the questions, you won't know. And you don't want a situation where you're developing solutions based on assumptions. And people are always going to see something that uses a top-down approach as a threat. Whereas if it's co-created with them, they see themselves as part of the process. They see themselves as part of the solution. And of course, all these things, like I've mentioned in my presentation, it takes a lot of work. It requires a little bit of work. And we've done stuff like this with big international NGOs, where often their way of working is to sit in their office and come up, because they're all smart people who are employed to come up with solutions. And that's what our training tells us as well. We're trained to think of solutions. And so with human-centered design, we're saying, yes, it's great. You need to be able to come up with solutions. But in order for you to come up with the right solutions, you also need to understand the people and the context in which those solutions need to exist in. And so suspending that, jumping into solution to first really understanding the context and the problem. I hope that answers your question. And the second question is how to encourage collaboration amongst those who have not been invested. Okay. Can you wait for me to read? How to encourage collaboration among those who may not be invested in the process of human-centered design approach? So there are different ways in which you can encourage people to be invested in the process. We do, short introductions, so immersive introductions, so that people can actually experience, because right now, all I'm doing is telling you about human-centered design, but the best way to learn the approach is to actually immerse yourself in it, to participate in a short introduction. And by short introduction, I've worked with organizations where they would ask me to either come and do a one-day introduction for staff, so one-day immersion, or a 3-day immersion, or a week-long immersion. So it depends on the context. And what we've done in some projects is when you're doing an immersion for staff, if it's staff that works within communities and work with government and other stakeholders, we make sure that during that immersion, all those stakeholders are in the room as well. Because if you can go through it together and learn it together and be introduced to it together. That's usually helpful. It makes it easier then to propose it as a way to do a project because you've all experienced it. I hope that answers your question. Shall we move on then to the next one? In terms of diversity among staff, how can you deal with an assistant who does not take instructions from you, but seeks confirmation from your superior before acting? In such a case, the assistant has a personal relationship with your superior, and because of that, she or he tells the boss that this person has asked me to do this. Should I proceed? Sometimes it can even be an instruction from the superior himself, but yet the person goes to confirm, thus undermining you. Very interesting. A very interesting question. So I mentioned that one of the things that we use human-centered design for is to design ways of working. And I won't have answers to all your questions, but what I can think of at the top of my head is it might be helpful to actually, for you to gain empathy for the person that is doing this. So have a conversation, invite them for a cup of coffee and just, try and understand from their perspective, is there anything that you are missing? Because the only reason that I can think of for a person to do that, it's either they think that they can't, they either think that they are not supposed to be taking instructions from you, which means there could be a gap in terms of communication, or a gap in the understanding of where they fit in within the department or the entity. So one of the things that we usually do as well is just to run co-creation sessions, team co-creation sessions, where each person just, we all unpack our understanding of the whole department and how each person is responsible for whatever they're responsible for, and how whatever they're responsible for fits in within the bigger picture. Because if that is not done, if human beings we all sort of get caught up in our own world, in my little thing that I need to do, but having an understanding of how my little thing that I'm hired to do fits in within a bigger picture sometimes helps. But the other thing is also to help people understand how me as a person, my own behaviors, what are our values, what are my individual values, and what are our team values, and how do we address challenges within the team? So some of the things that we do within the human-centered design space is to create what we call a team charter, especially when it comes to, working in collaboration. So right at the beginning, before we jump into anything, we develop a team charter. And a team charter is just us unpacking our ways of working as a collective and how we're going to address challenges because challenges are going to, emerge. If you're working, in a team of diverse individuals, problems are going to come up because teams also goes through, different stages of development as well. So what do we do as a collective if something like this happens? How do I address my team member if something like this happens? And if all these things are clarified and everybody is on the same page, it makes it easier to deal with challenges. But if that is not done at the beginning, then you find yourself in a situation where there's all these tensions, there's all these, misunderstandings that are happening. So there's various tools that you can use, especially as a manager. The starting point is just, understanding from their perspective. Perhaps just grab a coffee and say, I just want to understand. I've noticed that, but also framing the way you frame the conversation with the person is also quite important, because you don't want a situation where they feel attacked by you. And so just framing it as simply as, I've noticed that every time I ask, you don't seem to get the task done. Is there anything that I'm missing? Is there anything that is happening? Maybe you have other tasks that I'm not aware of. Then a person can start opening up. Oh, I didn't realize that I didn't think it was a priority, or whatever reason they give you. Then, this is where you can ask your why questions, which I love doing. So why do you say that? And you get to the core things, the core insights of why the person is behaving the way they are. I hope that helps. Of course, without fully understanding the context, I can't give specifics. I'm just giving high-level suggestions, which I hope they're helpful. All right. Are there any other questions?
There's one more if you look in the Q&A from Ramonde.
Okay. Thank you, Kinele, for raising the understanding aspect. But what is the perceived threat? What if the perceived threat is from the local government side, power holder, and not from the community for being willing to collaborate? So once again here, a government official is a representative, right? And they are there because they represent government. And it might be useful to actually involve them in the process as well. So invite them in the conversations with the community, and also to make sure that the conversations with the communities or the interactions with the communities are designed in such a way where everybody has a voice and everybody is allowed to share because by allowing people to share, that's when you actually get to learn what are the real issues, because sometimes we take the first response as the real thing. But actually by digging deeper, you might realize that there are other issues or there are other reasons why the politician is behaving a certain way. Maybe they are protective of their, constituencies. And so you have to involve them, you have to understand from them, and you can only understand by engaging and having a conversation and asking the right questions and bringing them on board in the conversation and making it clear that it's not about, it's all in the interest of ensuring, health for everyone in the community. And I'm sure everybody is interested in ensuring that their community is healthy. And so always putting that, foregrounding that as an issue. Because it's easy, like I said, it's easy to lose focus and get caught up in all the other issues that have got nothing to do with why you are there, but constantly directing the conversation into the fact that we want to ensure health and well-being of everyone in the community. And in order for us to be able to do that, we need everybody to understand. So are there any things that you need as health professionals to clarify So from your perspective as a health professional, it's also about making the language accessible. So the things that you're talking about, if you're talking about immunization and all the related stuff, how do you do that in a way that, in a language that is accessible and understood by the community members that you're speaking to? Because language can also, we can include and exclude using language. I hope that answers your question. I see there's another question. Oh, it's just a thank you. All right, I think that is me. If there are no other questions.
Inelwe,
Yes,
it's Greg here.
Greg.
I can't
Okay.
let you off the hook.
I hope I was off the hook. Yeah.
No. Wonderful presentation as always, the examples you illustrated your talk with were excellent ones and clearly applicable. I was very interested in the magnetic clinic and the PATH project on better data, because that the sort of trying to make use of better data is critical to the services, and likewise, getting people to attend clinics for all sorts of different reasons is essential. Otherwise, you're doing a disservice to the people. Has there been any follow-up on this? I mean, in terms of implementation, are you aware of what's happened subsequently after you went through the process with the people?
Yeah, so I haven't followed up with the team, even though I can actually follow up to find out what has happened, because I have the contact details of all the team members that worked on the project. The PATH one, I don't have the contact details for the people involved in that.
Okay, because I think that one is, I mean, we've highlighted the importance of data
management,
data management, using data for better decision making has been critical. So maybe from our side we'll follow up with PATH to see whether in fact there's been any progress with respect to that project. But once again, thanks very much.
Thank you, Greg. All right. Any other questions before I hand over back to Ben? No, over to you, Ben.
Thank you so much, Kenele, and as always, much appreciated and excellent presentation. We look forward to continued collaboration with you on this. And we've come to the end of our 5 webinar series of refresher vaccinology training to our alumni, as well as to those that may have been interested in just getting to understand some of the emerging concepts in vaccinology. So we will open up these next 7 minutes to hear any specific feedback from the participant, and tell us what are your perception and your experience in attending this session, specifically this one, but also for those who have had the chance to attend the other 4 webinars. You can tell us what you think. We're going to reach out to you on email, but I think while fresh, please share your experiences, raise your hand, and Salim and Nena will give you a chance to unmute yourself and speak to us. You can even show your face to us on camera. And anyone who has a specific comment, for example, is there something that you'd want us to do again in terms of run the webinar series? Is creating an online platform where you can stay engaged and connect with others, something that you think we could help you or help each other with to make African vaccinology community more connected. Let us know your thoughts on how we can take this forward and improve this training. Anyone? Nena and Salim, please have a look at the participants. Is anyone keen to give their feedback? Okay, if there isn't, I'm going to make some remarks and indicate the way forward, and also invite my co-hosts, Greg and Rutani, to also make their final remarks before we end this webinar series. I think for me, it has been very, very good, and very impressed with the participation and the questions and the comments that has been raised by the participants. And also to indicate that we're very happy with the quality of the speakers and moderators that have partnered with us to deliver this vaccinology refresher training. And to mention that the recordings for all the webinars are available. There is a link that Nena has shared, and you can always access those recordings. I don't know how long they're going to be available for access, but we want to keep them as long as possible. And then the other issue is that we now plan to have to resume our face-to-face annual African vaccinology course in November. And one of the ways we market this course is actually to send flyers to our alumni. And we will include your, if I hope it's okay, we send you the flyer when the applications to apply are open, and then you can share it with those that you think are the best to come and attend this course. We're going to have it in Cape Town, and depending on the funding, we're thinking of having about 50 to 60 participants funded to come to Cape Town and attend the face-to-face. As usual, we make the course program very reflective of the emerging issues on the continent. It's very focused on Africa. And we also have a session that we're going to have for NITAGs, hopefully in collaboration with WHO. And NITAGs are the groups that advise the Ministries of Health on issues around vaccines and immunization. So we will post all this information on the VACVA website. So keep looking. And also we are very keen to keep the VACVA website educative in terms of emerging issues and other key resources that are useful to support the work of researchers, as well as to make the public aware about the benefits of vaccines and immunization. With that, just to say thank you very much. And before I hand over to Greg or Rutan, whoever goes next, I'm going to say thank you to the participants who have been very active and making this webinar series successful, and also to our speakers and moderators. And also thank you to the VACVA team who have been in the background making sure that everything runs smoothly, specifically Nena and Salim and Edina, as well as Chantel. And also to Pfizer for giving us unconditional educational grant that made this webinar series possible. And obviously to other support structures we have from the University of Cape Town. With that, thank you so much, and I'll hand over to Greg or Rutani. Thank you.
Thanks, Ben. I'll go first, and then Rutani can have the final word, as they say, because he loves to have the final word. But just to echo your comments, Ben, I think that we have to thank the participants for joining us over these last few weeks for these webinars. I think that, as Ben said, it's important for us to get feedback because you know, we don't want praises. We want to know what didn't work in a sense. So, I mean, for example, were the webinars maybe too long? You know, was this a bad day Friday? And technically, it is for some of our colleagues, especially our Muslim colleagues who may have to go to mosque on a Friday. This may be a bad time, so we need to be mindful of those issues. So what is it that really worked, and what is it that didn't work? Ben mentioned the face-to-face meeting happening in November, and you know, we'd love you to spread the word once you get the advert. We will also be probably doing this via Zoom as well, so it will be a hybrid event. So, you know, for your colleagues who may not be able to attend, they could select the sessions that they would like to participate. And just finally, we are planning to develop a full online course, structured and taking into account all the issues with respect to vaccinology. And that's quite far advanced in planning, and we'll let you know about that as well. And you know, we could tailor this to the needs of individuals in countries, or we could tailor this to the needs of countries in a specific region. So just for example, if I use West Africa, you know, yellow fever is a problem mainly in that area rather than in Southern Africa. And maybe there should be some sessions on, for example, yellow fever and what's the current thinking, etc., etc. So I certainly enjoyed the series of webinars. You know, you always learn something when you participate in an educational activity, and certainly it was enlightening for me from a personal perspective. And once again, thanks very much. Ruds, you have the last word.
Thanks, Greg. I don't actually have much to say. I don't need a last word, actually, but I think it's, I just really want to appreciate, I mean, first of all, everyone who made themselves available to attend this course. I know that a lot has been said also about the people who organized this and prepared talks and did the technical stuff behind the scenes, and really, and I think Ben has already thanked everyone in that respect. But I think one thing to just appreciate is also your role of everyone who's here going forward. In a continent in which slowly we are seeing low coverage, even where vaccines are available for COVID and other things, where all of us here have now become those ambassadors for spreading the message about the value of vaccines. And I think these courses are very helpful in keeping up to speed, updated, new information, including for countering this growing scourge of lack of vaccine confidence and sometimes outright vaccine hesitancy that has got the risk of undermining whatever gains we've made over the last 40 years in the continent. And so thank you again, and thank you for being those ambassadors going forward. Have a lovely weekend ahead until we meet again. Thank you.
Thank you, everyone.